Hello, my dear friends. Welcome to Aspire32. And it has been always a pleasure to see your friends, your colleagues, your students to come on Aspire32 and listen to them, their journey, their success. And, as a teacher, I always feel proud to listen to their achievements. And today we have Dr. Nidhi, who is also alumni of KLE Institute of Dental Sciences. And it's a long resume, which I want to keep it very short before we discuss about today's important topic, that is the residency or master's program in United States. Dr. Nidhi finished her DDS in United States in 2012 in the University of California, and then she did her master's in pediatric dentistry in University of Connecticut. Both are highly respected institutes over the world and highly competitive institutes to get into, and it's a my privilege to listen to her, and I'm sure whatever she is going to speak on Aspire 32 is with her experience. Of course, that journey, I'm sure it was always challenging, and that is what she's here to speak. And welcome, Dr. Nidhi, on Aspire 32. It is great to see you today after so many years.
Thank you, Dr. Shenvi. It's my pleasure, and I'm so glad we connected. I know we went to the same dental school, and it's just I'm so happy to see what you're doing in India, and I'm so happy to be here for your listeners to gain something from it today. And please feel free to distribute it and have them ask me questions if they need anything.
Thank you so much. And let us start discussing about your journey, which is quite inspiring. So before we discuss about pediatric residency, I'm sure it was in 2000. You said, when did you finish? I mean, how long it is since you moved to United
It's been
States?
10 years. It's been 10 years. So I moved here in 2012 for DDS, and I came directly after BDS. So I
Okay.
gave my national boards and my TOEFL during my internship. So I came here right after. And so, yeah, 2012, it's been more than a decade.
So you got into the DDS program after your undergraduation in India, or did you do something else before you got into this DDS program?
No, I directly came after KLE. It was directly UCLA. I got lucky. I think I knew from my third year that I wanted to come here. So I started working towards that goal during the internships. I did a lot of community service, and I got into leadership positions. And during like internship, I decided that I wanted to build my resume and gave my entrance test. So it worked out. I got lucky.
This is something which is very important, and I think majority people who succeed in going to US or taking big decisions, they work early in their life, before they even reach that stage where they want to apply to these things. And it is amazing to hear that you went into DDS just with the undergraduation, which nowadays students find it very difficult. But do you really believe that is it possible even today to get into the DDS programs just with the undergraduate course of India?
So, Dr. Shenvi, I'll tell you one thing. So, my sister was here for 4 years before I came. She was in IT branch. So, but she knew how United States worked. She knew she had gone to a master's program here, so she knew like how the education system is here. So, I didn't want to even come to US in the beginning, and it was only during the end of my medical or dental school in India after KLE, I was like, I don't want to do specialization. What do I do? So, because she was here, she inspired me to come see the university. And when I came here, I realized that the dental students over here have to do like a 4 year college where they have to build their resume to a point to get into dental school. So what helped me was to just understand what is needed to be a part of the dental school. And something to your question, I think it's absolutely possible that people can come directly after BDS. And I was told during my interview that I was at an advantage because I hadn't still learned a lot of wrong things in dentistry, and I was fresh for the American school to teach me and become something like an American dentist. So I loved that I had the theoretical background from BDS, but then the practice of dentistry started over here. So they loved the diversity in their programs. I was the youngest in my class. There were students there for 10 years practicing in different countries. But me being younger actually was a good point for them. So everybody's story is different. My biggest advice will be stick to what's true to you. If you know that you want to come to US from an earlier years, then just work towards it and you can get it. It depends on how you have planned your application rather than how many years of experience you have. Sure, experience helps in clinical dentistry, but that's why we call it practice of dentistry. Even now I go to CE courses, we all keep learning dentistry part, but it's how we show up as our personality matters a lot.
So if you want to list down 5 points for an undergraduate who is listening to this podcast and he want to go to US,
Mhm.
because you had that thought during the third year, of course, that time also you may have made some list that, okay, I'm going to do these things. So what would be those 5 points?
Okay, I actually wrote it down because, it's important for us to be organized. And I want this podcast or whoever is listening to get some practical tips out of this and not just listen to another fancy story, because I want more people who want to come here be empowered by it. So I'm going to refer here, and I'm just going to go over what I had in my resume, which I think is relevant to the application process here. So number one is obviously now there's no scores, so that is to our advantage. So after we have our pass and fail, we have our passings done. Of course, in India we have our scores that matters, and our GPA does matter a lot. So if somebody wants to come, I think they should focus on getting good grades, but at the same time how to write the application and how to write the CV, being it grammatically right. So making sure that our scores are good is important. If for any reason the score is not good, then we have to have a good story. Everybody goes through a challenge. So how do we show to the American audience or people who are reading our CV in a way that this happened in my life, this is why I got bad score, but this is what I did to improve it. So over here, authenticity is really key, storytelling is really key. So having good scores or not, then having a good reason for it. Second, I would say community service. So in India, we do a lot of public health training. And I remember this when I was writing my CV. I didn't even remember, or I didn't even pay attention to all the community rotations I did. And we went to, I forgot the name, but we went to the villages and we
Yes.
serviced. But
So
we
many
didn't.
camps, our institute does during the
Yeah,
undergraduation.
exactly. Yeah, the camps we used to do, and I didn't realize that that was a big deal. But if you know the story of it, that is probably the number one thing. If you can portray what you saw in the rural India, and we take it for granted that it's a part of our rotation and it's a part of our application, but that's the key. You can make a really good story out of it, which is true. But I think we just have to learn to express our experiences in a way that touches them. And I think it's a key. We already do it. We just have to show it as a volunteer experience and what we gained out of it. So community service. I think another good thing that they look at is leadership experiences. So if you know that you were a student president, or you took part in Trinity, in our college it's called Trinity, the annual fest, or anything co-curricular you did and you helped in organizing it, I think that helps a lot. So I had a leadership and award section on that. So those were the three big things. And yeah, then you can also bring your personality out in the application. So I love yoga, I love meditation, I love like children, psychology. So anything that brings out your personal brand, like some people like art, some people like music, anything extra you've done, they focus on not just academics, but an overall person. So I think it's important that anybody who's listening and they have different passions, they don't just focus on their application from a dentistry point of view, but what makes you who you are. And I would say the fifth one, the letter of recommendation. So I know it's the hardest thing. Sometimes it feels like, oh, where do I find one? The truth of it, we sometimes have to give our professors writings, like how to write it. And that's nothing, it's just learning the new style. It's once you understand, even into getting into residency, we needed that. And I would say personal statement is equally important. Knowing storytelling is such a good art to have in life. Like, we see TED Talks, like it's simple things, but portrayed in a way, or expressed in a way. I shouldn't say portrait because it's truth. Being authentic and writing everything on their application as true as possible is important. Do not lie, do not fake it, because you will end up revealing it in the interview, and it will be very obvious that you didn't write your application. So I think being true and just getting some coaching on how to write your experience and finding those small incidences during your dental school, it's just important. Sorry, I'm keeping it very long, but stop me
No,
whenever.
please. We need information. I'm sure, we don't need limited information. We need more information. That
So
is
yeah,
very rare to get. Yeah.
yeah. Those would be my 5 key points: like getting good scores, leadership experience, community service, showing your true personality, your passions, and keeping your letters of recommendations and SOPs really
Yeah.
real. And
Those are really amazing words. Yeah.
it's important to have it English to be right, because of course you can have 102, 120 on TOEFL. I don't remember the scores, but it's important that our application shows a professional front. Our picture has to be professional. It can't be on a random background. You can't be like not smiling. Like, give it your best.
Okay.
Have your application really proofread by somebody who has done it, has helped, like gone through the United States standards. And a lot of people in India have that. So I'm not at all saying that you have to have somebody from America look at it. I think Indian people have better English than over here. A lot of times they're shocked. They're like, how long have you been in India? Or how long have you been in the United States? And I tell them, and they're like, your English is better than a lot of people here. And that's just because we are taught in English medium. People here don't realize that Indian people
Yeah, I
do.
think they realize that there is a different kind of India, because even when it comes to dental practice, I know we have to improve at various stages, but there are so many good labs nowadays which people do not understand. Okay, we also have so many facilities, so many advanced system here, but that's okay. They have not visited our country majority of the time.
A lot want to. Honestly, I think India is their number one destination
Yeah, but
for
I
the
don't
culture.
think, yeah, I don't think it is to see how advanced is it, but it is more about, how spiritual and
Culture.
So I do agree that, because I have visited US, and whenever I used to go to exam center, I used to take the Uber or Lyft, that's the service there. I used to ask them, have you come to India? I want to come there. I know that it's very spiritual, but it costs a lot of money, and $1,000, $1,500, and I have come to US to give the exam, spending so much money. Dollars has a lot of importance there. Because I do understand it's earning money is difficult everywhere. So you have listed down very important points, and someone who is in early date of BDS, this is how somebody has to think, because that she's the right, she's the right example for you. That if you think at early stage, you can achieve that, and she has done it. So now
And
let
I
us
would
move.
say,
Yeah.
Dr. Shen, just quick thing on that. Not everybody should come to US. I think it's very important to know why you want to come to US, because there are a lot of things that once you come here, you would realize that why did I come here? So it's important, of course, to there's a lot of money that goes into application process, like you know. So it's
Mm.
important to utilize and being crystal clear that I may fail, but I really want to come to US and for XYZ reason. Then you will have that passion to perceive and just know what your future is as much as you can, and doesn't you can change it always, but knowing it in advance helps you go through a streamlined process, so you're not wasting a lot of money on
Yeah.
the
No,
path.
we did one recent podcast where one of our colleague who returned from US, he spoke why he returned. And
Mhm.
then we also have a podcast about the statement of purpose, which is
Mhm.
sometimes difficult to grasp. We have done that. I'm sure the viewers can go through the playlist section and they will find it. You mentioned that interview is something which is very important, and we don't have a lot of information about the interview. If you can give some tips to the students on how good you can prepare for this interview, because I heard they do decide about the candidate based on the interview also. It has a lot of importance. What is your advice on that?
So I would tell that once your written application is approved, once you've been invited to your interview, you really have you know that you have very high chances of getting accepted. And the reason is this is your chance to prove not prove but show your entire self in person. It has so much more value than whatever your achievements are in scores or marks that you got or things that you've done, because they invited you out of so many applications. That means they like you. The only thing now you have to do is convince them that what they read on the paper is who you are and you have a personality and you want to come. So I think knowing what you wrote in the application, being true to it, and making sure that you're prepared to answer the questions what you wrote is important. That's like the very, very basic part. So just knowing that you didn't lie on it. The second most important thing I would say is getting a command on how you express. Like being confident is such a huge thing. You can, like, I was not confident, and I won't say that I was the perfect candidate. I wasn't even selected the first round. So I got selected because I was on the wait list, but I was waitlist one. So somebody didn't go and I got it. So that's why there's a lot of luck that plays into it. So never feel sad if you don't match, but know that you do your best. So confidence is important, but how you get it is by rehearsing. By rehearsing, like I'm talking to you, I rehearsed my even talking to you, and it's important because not everybody is good on camera or good in person. They are the best inside. So be in front of the mirror, talk to yourself, talk to your peers, record yourself, see how you're sounding until it becomes real to you. So practicing talking out loud is very important. What other things I can tell you is question wise, I think it's easy. They want to know you as a person, they want to know you as a story, and it depends on which school you are interviewing at and what program are you interviewing at. So I did twice, right? I did for DDS and I did for my residency. Even though they were very similar, But because I was in different stage of my life, like when I was interviewing for DDS, they wanted to know more about my experiences in India and why I wanted to come to US and join a United States school. They were very curious to see that am I going to stay in US and what will hold me here, or will I just go back to India? Because they don't want to train us or have us be a part of their program if we ultimately may want to go to India, back to
But why
India.
will somebody do it? I mean, it is so much of fees, so much of fees you are
That's what
paying.
we feel. They don't understand American dollar
Okay.
versus rupees. I think they want to make sure that we will serve over here
Yeah.
after getting that education.
Mhm.
And I may be wrong. This is just this entire.
Maybe they just want you know the vision, your vision, what or where you will be after 5 years.
Yeah,
Maybe
because
it's
they want
something.
to
Yeah.
put a stamp, right? Like if I'm a UCLA graduate, I will always be a UCLA graduate. I'll always be a Bruin. So they want to have the pedigree of people who will carry that name forward. So I
Mhm.
think that's one thing. Um, so what I mean is you could be coming back to India and bring that glory to their name, but show them how will their name be successful if you were planning to do so.
Yeah.
Another thing why they would want to see is, for example, in residency now. So coming to an interview tip for a residency, they have to make sure that you're interested in that residency for the right reason. So you have to be honest in which residency you're applying. It's not like in India, you go for a counseling and then you pick the first one is oral surgery, or I don't even know which one is more important. But like it's not ranked. Even like in BDS, I didn't want to be a dentist. I wanted to be a medical doctor and it didn't get the score. So I chose my second best. It's a true story. That doesn't apply over here. And
Yeah.
now I see why. Because I am practicing pediatric dentistry. I see 30, 40 just kids all day. I don't see adults. Versus it's
Mhm.
different in India. India doesn't have that many, it doesn't have dental insurance. So we can't see so many kids and everybody's doing everything. But over here, you have to make sure that this residency I'm applying, why I'm applying to it, why, in my case, why do I love kids and why do I want to be a pediatric dentist? So being very sure which residency or which program you're applying for is important. Being crystal clear, they want to make sure that you're there for the right reason. And then this other things are the same, like community service, storytelling. I can't emphasize enough, but storytelling is big, and I'm sure you would have realized over here when you talk to people, they're like, "I know what you're saying. Just talk less. Tell me, tell me what you're telling." So that's why you just get lost in the story. But it's an advantage to have that skill.
Mhm. I agree to your point that India is difficult to do the branch which you may like, but it is not that people cannot get the opportunity. For example, I always liked the noise of the rotor. Whenever I used to go through the cons department, I used to like it's like a boy has the enthusiasm of the bike and the sound of it. It was like that. Luckily, because my rank was better in the entrance exam, I was able to get into the degree. Unfortunately, not everybody is in that situation. That is what happens in India. Otherwise, if you have a good rank and if you clearly know, it's like whether you love someone, or it's like whether you like someone. That's the differentiation. there
Yeah,
are
that's very
students there are students who are in this like state rather than the which branch they love. So,
yeah.
but if you know which branch you like, or you have passion at early stages of life, yes, it is helpful. But as you said, I'm not sure whether how were you as a student? Were you so outspoken? Were you expressive as a student in undergraduate?
In India, you mean?
Yes, I think you were more of a serious kind of
I know. I think after this, people who listen to me, they'll be sending me messages that who are you? I think I have changed over time,
yeah,
um, but not out of. I didn't do anything to do it. I think just life makes you a certain way.
definitely.
I
It's
think
your
I started
experiences
loving.
which mold you. Yeah.
I think I started loving what I was doing more than anything else. So why I say that is I always wanted to do pediatric dentistry, even in India. I love the playfulness of them. It just energizes me. So I knew that, but I wasn't happy doing like big procedures, implants, face. It's not my thing. But I knew that if I do pediatric dentistry, I may not earn money. Like that's a big thing that we all think about. We put in so much effort and energy and money into getting these educations. So somewhere we want to make sure that it's going to be a good return on investment. One thing I can tell you in America, as a dentist, you will make money if you are doing what you enjoy. The only way you will screw it up is if you're doing something that's not making you happy. So if you decide that I want to do even like perio and that's my passion, you can make great money. So money can come if you're practicing what you like. So that's why be true to yourself. We can help you, like people around, and if you have good mentors, if you go see how they're practicing, they can help you make a practice that will earn money as well and serve a lot of people. But do what you really enjoy doing. And it's okay to change gears if you feel like this is not what I truly want. And I would say the same thing in India as well. I think nowadays people are doing that, and I'm so happy to see it, that they're really following their heart, that what they want to do, because long term, to sustain in a happy career, you need that.
Yeah, well, that's what I tell my students every month, that ultimately it will be a job if you don't enjoy it. I should appreciate your enthusiasm about pediatric dentistry, because I am a root canal specialist. By the time I can finish one root canal, that much amount of time we may require to do one restoration in a pediatric patient. So, kudos to you. I had one confusion here. See, there are so many terminologies. Some people say MS in, maybe endodontics or pediatric residence, pediatric dentistry. Some people say I did residency in pediatrics. I did endodontics residency. Are both similar? Is MS and residency are similar?
Great question. I hope that I can give you this answer and you will not have this confusion anymore. So in America, I think everybody knows that residency means same as MDS in India. So it's a specialty, right? But what's different is some programs have a certificate program and some are master's program. So master's programs are usually 3 years, just like MDS. Over here, it's called MSD sometimes, which is Masters of Dental Science. Or Masters of Science in Dentistry. So it's just terminology. So that is exactly same as MDS in India, which is endo. Like I have MSD, so that's the same thing. Now the confusion comes when they just say MS. Sometimes when you're doing the residency, there's an option to do just a master. So bachelor's program, then DDS doctorate program, and then a master's program. Master programs means it's an academic program where you're doing 3 years, doing a research article, you're doing a thesis, which is same as in India. So whenever you hear a master's, that's that. When you hear a 2-year program, so there in pediatrics, there's an option. You can do a 2-year residency, which then you will just get a certificate. When you get a certificate, that means you didn't do the research or you didn't do a very elaborate research. So it's a certificate and not a master's degree. So you don't get another degree, you just get a certificate. So you can't put another 3 initials in front of your name. So does that make sense?
Yes, definitely. But is it board recognized? Like, will the dental board recognize you as a pediatric dentist if you have done a residency?
If you're done, so residency is both. Residency means specialization, basically. Residency is no degree.
So what's the added advantage of MS? What is the added advantage?
3 letters in front of your name, MSD. And it also helps if you were to go into any academic positions or research or faculty member, then it helps because you have a more academic background. But clinically, if you were to get hired, there's no advantage. Like if you were to open your office or open your clinic, it would not make, you both are equally. And board recognition is something completely different. After you do your 2-year or a 3-year program, you apply for board exams. So once you clear that board, then you get board certification.
You have seen the pediatric dentistry in India, and you are a pediatric dentist in US. What is the scope of pediatric dentistry in US compared to what you see in India?
So I think in America, I would say is really good. I have friends in India who are pediatric dentists, but they're doing root canal molars and extractions and impactions. And I'm like, you are a real dentist. I'm not, because I don't do any of that stuff anymore. I did practice as a general dentist too. So I did all the general dentistry stuff. But now when I'm doing specialization, I don't see adults at all. And I think when you ask me scope, I would say I'm biased because I think I know what America's system is now. I don't know still if India has that or not, but from my understanding, India still doesn't have dental insurance, and especially for children, they'll be like, teeth are falling out, I'm not spending.
Yeah, the awareness is very less. Yes. If you tell them you require restoration in deciduous teeth, no, anyhow it is going to fall. Why do you need any treatment for deciduous teeth?
Because there are a lot of families over here, especially Southeast Asian or other countries, families here will still have that. But I will tell you, Suresh, that it's same for anybody. You have to do education, but over here we are an advantage because a lot of school programs, when you are in preschool, a child has to have a dental exam before they can get admission in the preschool. So then it's a system it's in the system that they have insurance, most of them, and then they have to go to the dentist before they go. So I think the system is made to make it advantageous for the profession as well, and obviously it's serving the population. So I think the scope over here is really amazing. Pediatric dentistry is, I'm fortunate that I love it, and it's very, you can be very successful here. I have been in this for almost 4 years now, and I've worked in 3 different states. All states have their own plus and minus, like which population you're working with, and everybody's story is different. But if you love pediatric dentistry, your scope here is amazing.
How many patients do you treat per day?
About 30, like I said. And when I say treat, we usually see like one column of restorations, so fillings, crown, and root canal and everything. I
Do
mean,
you
full
use
part.
a nitrous oxide
Yes,
a
that's our
lot?
favorite. So we always do laughing gas. And
Okay.
then we do two columns of recalls. That's how it becomes 30 patients. Two
Hmm.
columns of recall means they're coming just for checkups, checkups, checkups. We are
Yeah.
not doing treatment. So we're not seeing the
Mhm.
patient when they're in pain or
Do
when they're
you do
too.
you feel the kids are different compared to India? Are they different?
Uh, oh wow, that's a good question. I don't think so. Kids are kids, and that's what I love about it. Because if you are good at connecting a child at a level that is childlike, they are innocent, they are fresh, I think it's not different. What is different though is parents. So when
Mhm.
the biggest factor in that triangle is child, dentist, and parent. That parent could be different in America and India, I would say that. So
Mm.
child is not, but maybe parenting is.
So it is more about handling the parent than the kid nowadays. I think
Yeah.
if you have seen kids in India today, like I
Mhm.
see my son, I know, and I see that they're so different than what we were. And I'm not sure when you visited India last time. When was the you did
It's been a
visit?
while, three
It's been
years.
3 years. So I'm sure you are also from a newer generation. You were totally different than all of us. Very creative, and maybe the patients are also different in India today. Maybe much closer.
What do
Very
you mean?
similar.
Like, what do you mean? How?
Means that
Like, what?
I feel you can explain them. They understand. They are aware about their they and parents are also quite challenging sometimes, but majority now understand the significance of that oral hygiene kids. So they do
See,
get them.
that's why the parenting, right? Like, parenting in India is shifting too. It's not more of like, I don't know. I hate restraint. We don't do restraint here, but I saw that in my rotation in pediatric department when I was in India. And over here also we learn Pepu's board and restraint. Hand over mouth is not at all okay over here. It is, you cannot do that. It will be a child abuse. That is very, very, like, something you have to be cautious about. So I think parenting in India is changing too. They're talking to their kids more, they're making them understand. So because America, if I just say white American culture, they always grew up their kids talking to them, so that's why it's easier in some ways. But their expectation is also higher because sometimes kids will not, like a 2-year-old, you cannot expect to talk to them, so you will do a quick check where you're holding, but you're not traumatizing it. So like now I see a lot of children with special needs and those who have had dental anxiety and fear. That's like my niche in even pediatric dentistry. So my whole focus is on their psychology, and that's why I like pediatric. Like I love kids more than dentistry, I say.
Yeah, that's I think that's something which is very much needed if you want to be a pediatric dentist. Uh, are there any types of pediatric residency in United States? Because I just heard that question somewhere. Do you have any types of pediatric
So
residency?
I think what probably people are referring to when they say is something that we covered just now. There could be a 2-year program or there
Yeah,
could be
and
a
the
3-year
3 year
program.
program.
That's one.
Okay.
But then the other thing you have to be careful is, or not careful, just be aware of is there is a hospital-based program and there are academic-based program and
Is
there are
that like the GPR and the advanced education in general dentistry?
something similar. Like if you, there are some hospitals in United States who will take residents only if they have experience. They will not take graduates right out of DDS. So those are more hospital-based program because they're seeing a lot of patients and it's like a like AEGD or GPR. But then there are academic programs which are like a lot of theoretical based. There's research. There is a lot of focus on academics, and then there's a portion of it that you're going into hospitals. So that's one. And then I think another thing to just know is, I'm sure a lot of listeners would want to know is how can they directly apply to residency versus if they have to do DDS and then apply to residency. And that all just comes down to the number of programs that are accepting direct applications, which are very few. And then another thing to consider is if they're going to pay you doing the residency or not. So some programs pay you to do residency as a stipend, and then some you have to pay tuition on top of it.
Yeah. There is one confusion here also that someone told me that when you are learning for the first time in United States, you have to pay the fees. But then
Mhm.
when you are studying in future, like if you're doing another degree, you don't have to pay any fees. But there are some who say that you will have to again, if you're going for a new residency or new degree, you will have to again pay fees.
Depends on the program you got accepted to or you're applying to. Some, it's very clear there's this much tuition for this course or this pay stipend. And some programs stipend is more than tuition, so your net is positive, and sometimes it's the other way around. So it all depends on which program you're applying for. Both situations are possible
How
to
much?
get it.
Yeah,
Sorry,
please
go
go
ahead.
ahead. Please go ahead.
No, it just depends on the program, that's all.
Now, how much is the pediatric residency cost in United States?
most of the residencies, especially if it's hospital based, it's free, no tuition. If you're doing a master's program now, anytime you're doing master's, so that's another degree, you're paying some tuition. Now your stipend can be more than your tuition, so your net is positive. So usually I would say for a master's program, it's 10 to 20K a month, a year. So $10,000 to $20,000 a year,
Okay.
depending on the programs, I think.
What is your day like in the residency? And maybe you can give a comparison with India also. What do you do whole day?
Yeah, I can tell you about here. I did not practice in India, so I can't compare. So you can tell me how it's different. But over here, so it's mostly like a 9 to 5, and typically we start at 9. Most of the places here don't have evening clinics. So even though I think it should happen because a lot more patients we will see, but I think everybody's just that's standard work hours and everything else is emergency. And if you have emergency, somebody has to be on call and you can pick up and triage it over the phone. But 9 to 5, as a pediatric dentist, I see anywhere between 20 to 30 patients a day. So we see 1 hour treatments, which will be like pulpotomy, stainless steel crown fillings, and most of them are under nitrous. Or if they're very little, then we don't do nitrous if they don't need it. Then there are 2 columns. So we always have assistants or dental hygienist that we are overshadowing. So there's 2 or 3 running 2 more columns of patients every 30 minutes, which are coming in for a regular 6 months checkup. So they will be like sealants or SDF or any education or follow-up, space maintainer, cementation and stuff like that. So every 30 minutes. So that comes down to almost like 8 to 20 patients, depending on how busy your practice is, obviously. Sometimes in rural areas where you're working, you are seeing tons of patients because you're seeing state Medicaid patients or insurance patients, versus when you're in private practice, it doesn't take state insurance, then you see less volume, you spend more time.
We do have a lot of patients, especially when they have vacation. It is not that they come during the school days. That is something which is lacking in India, that when you have time you come for the dental appointment. That is what happens, or unless it is a emergency, like a kid has a very severe pain, right?
Yeah, see,
Normal.
that's the thing. Biggest thing I think in pediatric dentistry is prevention and trauma. You have to just make sure that it's given early, like early childhood decay, milk, bottle. Like I think we do so much on talking on prevention that they don't need those emergency situations. And this is so funny. People here, and if I reflect back, I didn't go to a dentist until I was at KLE. Like that's how it was. And we didn't grow up going to the dentist. And if I share that with anybody, it's so surprising to them that you're a dentist and you never saw a dentist for the first 18 years of life.
True. The same story here.
Right. So I think that's such a big shift, but I think it's happening. And the more people like you and people who are coming in the forefront, who are willing to share stories, who are willing to educate, not just to other dentists, but also to like patients, and newer parents want that. They want to be more preventative. They don't want extensive work. So I think it's really, I take it really seriously. And it's such a privilege to work with young children that we can impact so much in their life.
That's true, and not just pediatric dentistry. Even prevention is equally important. I'm a restorative dentist and endodontist. I believe that the prevention is the best, and the restorations are better, because I know that what restoration you have done today will end up in root canal after a few years. So if you can prevent it, there is nothing like that. But unfortunately, majority of the dentists do not educate the patient that why at this stage treating that is very important. That is what is lacking. The patient education is improving here too. You finished your DDS in US, you finished your undergraduation in India. What was different between your education here and there?
I think this is going to be funny, but in my interview for DDS, I was asked, how many crowns did you do? Amongst all the other questions, they wanted to know my dental background, right? And he asked me, how many crowns did you do? And I said, I was honest. I'm like, I didn't do any because I barely did my class.
On patients. You are done. You are done it on typos, not on patients.
Yeah, right. So I'm like, I barely. So I was like, almost, what should I say? Because answer is 0. It's not even like 1 or 2. So I said, I didn't do any. And the exam, or not the exam, the interview literally said this: you had 0 crowns on patients. He said that. I'm like, I'm not for sure. Like, but I think I realized that time that somehow it was okay, because they knew that in India or even in any other country, we were focused so much on education, so we were very good theoretically. Like we could tell them the perfect book, what we had read, all the books that these people had written. So they knew our theoretical background was so strong, and what they needed to help us with is the clinical part. So when we do DDS here, we directly are a part of third year where we're just directly doing the clinic. So we did a lot of patient care. I think that was the biggest difference, that as a part of becoming a dentist here or DDS, I felt confident that I can treat patients. But when I graduated as a BDS dentist, I didn't feel confident. Like I was looking for volunteer positions to just observe other dentists to learn how to do things. I think that's the biggest difference, that I felt confident as a dentist that I know what I can do and I know what I can't do. Obviously, I don't know implants, I don't know advanced dentistry, but I can basically do basic dentistry without any further education.
Yeah, but this is one doubt which I also have. See, here we have a clear-cut differentiation between undergraduation and the post-graduation.
Okay.
You too have the MS program, is that how is that possible that the undergraduate student has more confidence in United States compared to India when you have the same master course or residency in the United States, which may be little bit, which may teach you more than what undergraduate can learn in US.
No, I think the difference is because as a specialist, you are just doing specialty cases here. Like once you decide to do residency, you're not doing simple fillings anymore. Or if you are an endodontist, you're not doing fillings anymore. You're actually not doing class 2 or saving a tooth. You're only doing root canals. If you're a perio, you're not doing fillings. You're only doing gums. If I'm a kid specialist, I'm not seeing adults. So I think that's a choice that people take when they do residency or they choose to do master's program. But if you were to just practice as DDS, and which most of people over here do, then they can do everything. And obviously that's the difference. And you get the exposure to all specialties hands-on in your DDS. But in BDS, I don't remember learning a lot except our internship year, which was also like limited exposure.
Theoretical. I do feel that it's more of, I truly believe we should shift all the lectures online, put it on YouTube, because YouTube already has a lot of good lectures and concentrate on teaching
I think
students.
having good mentors is important. I feel good mentorship is important. Like you can't teach masses. Like even if you are, then we group it down, and we are not. We used to learn a lot from our PGs, and that was good because we directly could ask our questions and this and that. But there was so much focus on exams and passing and clearing and ranks that we get, that you just forget practicing on dentist or like being confident doing things on patients, because that's the real thing. And once you learn teeth, it's easy. Like now you like, how can we read about teeth for 10 years? Because it's so easy. Once you know the pulp crown or enamel pulp crown, that's it. You can, but it's important. I think fundamentals is important, but clinical aspect is important too.
Yeah. Of course, everything about India is not bad, and I believe you have. There would be something which helped you somewhere in your journey in United States. Maybe it is our institute. Maybe because I know our institute. Majority times as a student we don't realize that how much exposure you get at our institute. But maybe you may have realized it somewhere you know in the line of your journey. What was those important things which may have helped you from which
I have so many.
took from India? Yeah, can you name few?
Probably I would spend another 30 minutes telling you. The reason why I'm over here is because of my education in India, because of my background, growing up in India as a human being, as a child, and going through those experiences. So I feel that I'm at a privilege because I have the best of both worlds. Over here, we see wastage like something that I cannot fathom. It could be paper, it could be dental materials, it could be time, but we are so resourceful in India that we don't have a lot of resources sometimes, but we help each other and it's taken for granted. Over here, you don't get that. It feels like favor sometimes when somebody's helping you. And there are a lot of good people here and a lot of good people. Like there's good in both countries. I think I love KLE's, like the way we were trained, the way our faculty members were. I never felt there was a lack. It's only that we got exposed to something even more, but there was more personalization in India. Like I felt friends. I still have friends from KLE, and our teachers are our friends because I felt so supported. And I think that is one thing everybody in India should realize, that if you're coming from India, it's an advantage if you leverage it right. So the reason why I'm on this podcast today is because I want more people in India to realize that don't have a fancy glasses when you look at United States. people can fail here, people can succeed here, but so is in India. And you can do so many more things in India if you do it right, because there is less legalities, there is less this suing power in our patients. Like there is so many things over here that you do restricted. If you want to help somebody, there are 10 different steps you have to go through to help. And in India, I think if you have a good heart, you can just directly go change and do dentistry the way you do. So I hope that I'm very clear that there are so many things that are at an advantage in India, and I love it. And I wish that more people can utilize the bridge between, for people like you and me, where we are here, but we always think about India. Like I miss India for the last 3 years because of COVID, I couldn't go. But when I come back, I would love to help India grow in a way where they feel confident. If they want to come here, that's great. If they want to stay in India, even then they love it. And dentistry doesn't become a second choice anymore. Like people want to do dentistry. I hope that we can reach a point where, just like here, people really want to be in dentistry from high school, and parents don't say that study hard, be a doctor, and you're not a doctor if you're a dentist. I think that would really help.
I think we should end the podcast there, because the ending cannot be, much nicer or more nicer than it. You have really spoken from your heart, your experiences, and of course, you have given a very important message to people, that people who are in India are also lucky to get all these benefits. And exactly for this reason, I tell my students that you should go and visit other countries, because that will also help them to realize how lucky they are, in their own country, right? So
Mm-hmm.
of course, but experiences are always beneficial. I want to thank you once again, Dr. Nidhi, for giving so much of your time. I'm sure it's early morning there. Thank you so much.
Thanks
And
for staying late, and feel better. I am so happy that we were able to do this. And if your listeners want to reach out to me for any reason, they can find me on Instagram, and you can leave my handle. They can message me. I'm happy to support them in any ways they can.